morning, Sri Lanka. And you're here with us. We're in discussion with Dr. Namal Senasinghe about how you can alleviate your daily back pain. Now, this might be something very trivial or it might be something very serious, but we've got the answers here on Good Morning Sri Lanka today. So, doctor, tell us about how you can treat these pains, because in Sri Lanka I think the norm is to just take a Panadol or a paracetamol and then go about your day's work, but that doesn't exactly solve the problem, does it?
Yeah, but I think it's still better than doing nothing. And I think, yeah, the first mode of treatment is pharmaceutical and then pharmacological, which is taking pills. And in 1970, the WHO, World Health Organization, did a classification called the analgesic ladder. 3 steps in the ladder. The first step is the simple analgesics. Paracetamol is the key. So 2 tablets, 6 hourly. So 8 tablets in total a day is good. And then you go into the other drugs like ibuprofen, 200 to 400 milligrams 3 times a day, and then diclofenac.
But these are prescription drugs.
I don't think so. In UK, ibuprofen is not a prescription, and diclofenac is not a prescription. None of these simple analgesics are prescriptions. And then you get the diclofenac 50 milligrams. I think in over the counter, even in Sri Lanka, you can buy them. So, but then the paracetamol is not dangerous unless you consume them in loads. 20 tablets, then of course there's chance of liver failure. That's how people do unnecessary things. I don't want to list them. But then the next step is, ibuprofen and diclofenac, and then you get the specific ones, COX-2 inhibitors like Celebrex, and then you got the meloxicams, and then these you have to be quite cautious about these. It can lead to serious side effects like gastrointestinal bleeding, ulcers, and then the worst thing is you can get renal failure. So I've seen people actually with renal failure not knowing that these can harm, and I've seen Sri Lankans with renal failure by taking these for a long term. So I think they can be nasty if you take them for a long periods repeatedly. Maybe once in a way it's fine.
Bring up pharmaceutical drugs, doctor. Now, like you said, there's tons and many types of pills. I'm obviously sure you've heard of the placebo effect.
Yeah.
Now, for those of you watching, the placebo effect is something, again, to do with the person's mind, where the surgeon or the doctor would trick the person saying, hey, look, here's a pill. This would cure whatever you have. But in reality, it's just the sugar pill.
Yeah.
Have you ever used this in your
No, I haven't. But I'll come to that in my my third modality of treatment, which is psychological.
Okay.
So I'll mention that. Can you raise that with me?
I will wait.
Yeah, because otherwise it will jump the queue. So these are the. So then we go on to the second step, which is a slightly stronger. Less stronger opiate, but slightly stronger than the first level. So these are known as tramadol, codeines. They should be prescribed, and they are moderate analgesics. Yeah, the other one was simple. These moderate. So these can lead to dependence and addiction. So you got to be very careful. And then the third level is the opiates or morphine, which is used for cancer pain and things. So we need to really monitor the patients. But luckily, they don't do any organ damage, unlike the ibuprofens and the other ones. But the most serious side effect with these is the addiction. If you're psychologically, you are weaker psychologically, or if you're prone, if you're an anxious person, if you're psychologically, some people can be more dependent on them than others. So that's a caution. So that's the pharmaceutical. I think it's not for the patient to decide, it's for the doctor. But simple analgesics are fine for the patients. I strongly recommend paracetamol.
What about alternative techniques, doctor? Now you spoke about drug therapy, but there are other things that people go for. There's physiotherapy, there is even hypnosis.
Yeah, very good question. Hypnosis will be third, I'll tell you. Number 2 is complementary therapy. So as an adjunct you can use complementary therapies such as physiotherapy is key for back pain. Yeah. And then in England there are a lot of private practices they do something called osteopathy. I'm not a great believer of these, but sometimes they help patients. Whatever helps a patient, that's fine by me. Yeah, as long as they are not strong dark drugs. And the third one is you can have acupuncture, which works on some people, and then there's something called TENS machines where you stimulate, you put 2 pads and then stimulate with electric impulse. They help, they are very harmless. And then, as you said, there's reflexology, there's aromatherapy, hydrotherapy. You get into a pool, swimming, they're all good. Yeah, listening to music, yeah, and that's fine. Sorry. And also the third one is the psychotherapy, and there comes the hypnosis. I don't know how relevant is that, but then there is a proven method of treating these patients by CBT, cognitive behavioral therapy. Unfortunately, I met one of the chaps in one of the hotels recently. He's a relative of my wife who is keen to start a CBT center in Sri Lanka. He's not a doctor, and he was telling me, Namal, I like to start this. Probably he's heard the CBT treatment, which is very good. My wife is also a consultant psychiatrist, and she's keen on these CBTs in England. And that is something to help people how to cope with the pain psychologically. Your placebo effect comes there, because if that gives you psychological confidence that you've taken something. So in effect, it acts as psychological therapy.
Right.
Yeah. So I think that's where it falls into.
What is a certain extent, if you don't mind me asking, that this placebo effect could be used to? Could it just be used for like everyday headaches, or something big, like for example cancer? Could it be used in?
I wouldn't use that, because that's cheating to the patient. As a doctor, we have taken.
Is there something ethical?
Not ethical. For me, it's not ethical, because we have taken an oath under Hippocratic oath. We got to be very honest, and I think we got to tell the truth. And I'm not. I don't do that at all. I don't intend to practice that either.
Okay.
So then there's a thing called interventional technique.
Yeah, that's where we get involved. I mean, drugs also we prescribe, but then we direct the GPs to go have this analgesic ladder, and then probably we discharge the patients. And then we refer to the physiotherapist, we refer to the psychologist, consultant psychiatrist. And then the last thing is interventional pain therapy, where we get involved. This is the intermediary between others and having surgery. And I'll bring a patient later and say even surgery will not help back pain, and in certain cases, yeah. So interventional therapy. So starting from the neck, I mean, if you have cervical spondylosis, pain in the neck, you do MR. If there are severe problems like you have shooting pain down the arm, which is called brachialgia, you should do MRI scan. There are red flag signs. Red flag signs are persistent fever with back pain, and then urinary incontinence, yeah, and then fecal incontinence, where you pass urine and feces in your clothes. And that could be, if there are no female urogenital problems, probably that could be due to nerves being pressed at the lumbar region. Okay, so that's serious. And also pyrexia, and also sweating at nights with back pain, and then any shooting pain down your leg. The key word is shooting, like a current. Patient will tell you, I have a current going down my leg or the arm. Sciatica in your leg, brachialgia in your arm. So these are called red flag symptoms. You need to go and see your doctor in England, and then he'll refer you to the surgeons. But in Sri Lanka, I don't know, probably if you have access to a consultant, a pain medicine doctor, you see them first, or you can go and see a neurologist. Yeah?
But this is where the newly opened Navaloka Center for Pain Management comes in, isn't it?
Yeah, but it has to be, the pain management is a specialty on its own now. Now I'm a fellow of the Faculty of Pain Medicine in UK, and so it's a fellowship. So I don't know how it works in Sri Lanka, but I gather a few doctors have put up their names, but then are they really qualified in dealing with these pains? I don't know. The answer is it's for the SLMC to find out. Anybody can say I'm a specialist in this, but have you got the qualifications to do that? Have you been trained in that? That's the question to be asked. And in England, to practice pain medicine, to be appointed as a pain consultant, you need to have a fellowship in pain medicine and training in pain medicine at least for 2 years. Otherwise, you won't get a pain consulting in pain medicine. I think that should apply here as well. You can't just open a shop and say, I heal pain. And I've seen a lot of people attached to high political powers treating pain. I have a lot of reservations about them. And I would like to challenge them actually, how they treat pain. And we can take few MRI scans and show me how you treat and cure these pains.
Doctor, going back to the symptoms you were mentioning before about, the electrical current,
Yeah.
couldn't it also be, because I've had this scare one time.
Yeah.
I wake up in the morning, I'm like, oh my god, my body's not moving, because apparently I had slept the wrong way and there was no blood going.
Yeah, it can happen, yeah.
And so people confuse that sometimes?
Yeah, it can happen because your nerves have been pressed and probably pressed, and it causes irritation, and then it goes to pins and needles, but soon as you relieve the pressure, it comes back to normal. But if you lie that for maybe a week, then probably you may not get your sensations, but because it's been transient, maybe 1 or 2 hours. That's why.
So what about the diet, what the patient eats, and can that affect your back pain? Is that possible?
Probably not, but I don't know.
There's no effect in that, is
diet? No, but then weight loss, yes, of course. If you are overweight, then it doesn't help back pain, because your spine is your shock absorber. Yes. Everybody is born with the same size spine. God has not created different spines for different people. So that little structure has to withstand heavy stuff. If the patient is 100 kilos, that small spine has to withstand that 100 kilograms. So it's going to be very difficult for the spine. That's why the more obese people have commonly they have back pain, not like the thin guys. When I see thin patients back pain, I'm relieved because I can be helped. But when I see big people, I can't tell them you are too big, but then it becomes challenging. That's the word we use in English. Your treatment may be challenging. That's the diplomatic word, yeah, of course. So. And also coming to the next one, then what I do is, for the facet joint problems, we do facet joint injections under X-ray. All back pain procedures should be done under X-ray.
I see.
That is otherwise it's negligent. I will be stuck off by the GMs.
Won't long exposure to X-ray during a back?
It all depends on the experienced hands. My exposure in procedures I'm not trying to boast about myself, but my exposure in procedures is less than taking X-ray.
All right.
Less than a chest X-ray. So it comes to about 400 units of X-ray you need for X-ray. Mine for core epidural is only 1. So my whole list come to 1.5 X-rays of a chest X-ray. So it all depends on the experience. But then I've seen people doing heavy stuff. So it all depends. You need, I don't know, the trained people will know by looking at the X-ray how he's performing.
But what about sportsmen then, doctor?